Neither the El Paso County Medical Society, its members, nor KCUS TV shall be responsible for the views, opinions, or facts expressed by the panelists on this television program. Please consult your doctor.
Good evening. I love the title of tonight's program. It's a special delivery for El Paso. We'll talk about what goes on during an OBGYN visit. We will talk specifically about pregnancies, special deliveries, and if we have time, we're going to touch base on a plethora of other issues that females face with their reproductive organs going on through past the pregnancy years, so to speak. During the next hour, we have experts answering questions about female reproductive system, and again, we'd like you to stay tuned for your questions. You can do that via old-fashioned telephone at 881-0013. You can also ask your questions by computer or tablet or telephone because we are streaming live on Facebook. Just go to KCOS TV and you will find this program on right now. You are able to text your questions and ask your questions on Facebook because I know a lot of people aren't in front of TVs anymore. It's all about whatever their device is. This evening's program is underwritten by Las Palmas del Sol Healthcare, and we also want to thank the Texas Tech Paul L. Foster School of Medicine for providing the medical students to man our phones this evening. Tonight we have with us two third-year medical students, which is lovely. We have Lock Win Vo, which you have met before, and then we also have John Piskey, and they're both about to take the, what did you say, the shelf exams? And I said, it's a big deal. And I said, well, what is different about it? They said, well, it's just another exam. But just another exam in med school is a big deal. So we appreciate you being here very, very much. I also want to thank the El Paso County Medical Society for providing this show to you each and every month for over 22 years. I'm Catherine Berg, and you're watching the El Paso Physician. There's 4 women on the panel today. All 4 of us. I don't think I've ever had an all-girl panel. So I think that's number one. We're making history today. It's always nice when that's the case. We have Dr. Nikki Barnes with us. She is an OBGYN. We also have Dr. Melissa Mendez with us, also OBGYN. And we have Sandra Aranda with us, who is Women's Wellness Educator at Las Palmas Medical Center. And you're going to be the one that's going to get all kinds of questions tonight. But what I want to do before we start, OBGYN, we were discussing this before the program even started. There is surgery also involved with what you all do. So a lot of people think of OBGYNs, oh, those are just the baby deliverers. There's a lot of surgery that comes in later too. The OB is babies, the GYN is all the other stuff. So on that note, Dr. Barnes, I would love for you to kind of tell the audience what you do all day, every day, and we're going to do the same thing with Dr. Mendez and also with Sandra.
Absolutely. I graduated recently, and I was fortunate enough to take a different path than some of my other colleagues and going into a private practice. But most of the time when you do that, you do come out doing about 90% obstetrics and 10% GYN, but everybody loves the GYN component because of the surgeries and timing, and you're not on call all the time. I got the benefit of actually being able to do that. So about 80% of my practice is GYN, and maybe about 20% is OB.
Nice. Okay. All right. So you're going to get a lot of the questions. We were talking about what our audience skew is. So a lot of our audience is already out of the baby making / delivering stage, but then I'm 52, a lot of that 52 to 80. There's grandma, and it's all the stuff that matters once menopause kicks in. So it's going to be a loaded show this evening. Dr. Melissa Mendez, so you also have a degree in pediatrics, is that correct? Or pediatric OB/GYN? You explained it, you said it before the show.
So you go to medical school and then you do your 4 years of general obstetrics and gynecology.
Okay.
There are some fellowships that you can do to do your other subspecialties, and I did get a certification in pediatric and adolescent gynecology.
Gotcha.
So my focus, what I do every day is I still do a lot of general OB and GYN. I don't do a lot of hysterectomies. I'll refer to someone like my colleague here, Dr. Barnes. And I do a lot of teaching. So my focus has been the teaching of medical students and the teaching of residents.
Okay, very nice. And our medical students love coming to the show because they get to talk to the docs. So that's something that we'll get to do after the program as well. So Sandra, I feel like you are an educator as well.
Right, I am an
and I think that you get all the crazy questions. So what is it that you do all day, every day? Is that even something you can answer in like a minute or so?
It is a fulfilled day because, of course, I've been at Las Palmas for 23 years now.
Good for you.
So I've got the role of the prenatal and the breastfeeding class. So I do those on Saturdays.
Okay.
I do that, and I've been doing them for a long time.
Is it every Saturday?
No, it's every the first Saturday and the last Saturday of the month.
Gotcha.
And
Okay.
they could call in, and we could go ahead and sign them up for the prenatal and the breastfeeding class.
You know what I'm going to do? We're going to do this several times throughout the show, but I'm going to throw that number out anyway in
Okay.
case you know someone that might
Very
need these
good.
classes. That number is 521-1279. Again, the first and the last Saturday
Yes.
of each month. Is that correct?
That's correct.
And like I said, we'll do that later, but that way. And also for all of you that are watching or tuning in, you can watch the show again, as well as you guys can watch the show again on kcostv.org and just go to Programs, Watch, and you'll find the El Paso Physician. You can also find it on the El Paso County Medical Society's website, which is epcms.com. And again, you can type in on Facebook El Paso or KCOS TV, and you'll find it there too. So, here goes. This is going to be a really quick fire show. When we talk about OB-GYN, and Dr. Barnes, I'm going to start with you. What is OB? What is GYN? Separate the two so people know what we're talking about.
Obstetrics is usually exactly what it is. It's a baby component of the whole process.
Okay.
It's caring for both the mom and the child at the same time.
Okay.
And that's throughout the whole process from beginning to delivery and after delivery as well.
Okay.
And the GYN component comes from, I guess, time as even a little girl having issues without even hitting hitting menses, their period, up until the time that they hit menopause.
Okay.
So you have a whole breadth of women's health issues at that time. So those are kind of the differences, I would say.
Okay, that's perfect. And actually, I think that's a nice transition into Dr. Mendez, because let's talk at the beginning of the years where a woman or a girl can get pregnant, a female can get pregnant. So from the time of menses, talk about the average age of that starting, and then where in the process are you able to get pregnant, and just take that anywhere you'd like to with that age of woman, child, girl, female. My gosh, there's so many words out there we can use. I'm just trying to be politically correct and use everything.
So the average age of puberty is 12.1, something like that.
Okay.
Years. And once that occurs, you may have some periods that may be sporadic, and so that's totally normal. I get that question a lot. Usually the first 2 or 3 years they may be irregular, and then they tend to be regular. But you can actually ovulate at any time once you start menstruating, and you can get pregnant at any of those times. So
Okay.
I know we don't like to think about that.
No,
but
I think
it
it's
can
important to talk
happen.
about that. So I think that's a big deal. And I think on that note too, just because we're educators and this is what we're supposed to do, when you're 12, people aren't thinking about sexually transmitted diseases. So I also want to talk about before the age of menses, or at least before sex, let's talk about the vaccinations that are so very important at this point of the life in a child and a girl, etc.
So one of the biggest things that we deal with is HPV, and that's human
Exactly.
papillomavirus.
Okay.
And we now know that this virus is the virus that causes cervical cancer. And we do recommend that everybody, women and girls and boys, get this vaccination between starting at age 9.
Okay.
If they are vaccinated before age 15, you only need 2 shots. After that, it is a series of 3 shots.
Okay. And I'm glad that you said boys. I have a 16-year-old son, but when he was 14, I had a show similar to this, and I was like, boys too? I think that was actually earlier than that, because originally you would see commercials on the air, and it was about your teenage girls and have a conversation, and then boys came in. And my son's like, yeah, I want to be protected with everything. And he came in where you only had to do the 2 shots, so that was really nice. Sandra.
Yes.
I'm going to ask you, so it kind of gets us started in the whole baby situation. Let's talk about prenatal.
Yes.
So somebody just found out that they're pregnant.
Yes.
Is there a prime age to be pregnant? Like, is it like, if you're looking 100 years ago, it's 14 to 19. Now people are getting pregnant, and happily so, into their 40s. So I'm asking you that question because prenatal classes, I'd imagine you've got sometimes generations of
Yes,
people
I
in
have
there.
a different range. It could start from age 18, 19, and those are your young ones, and I have my patients up to 45, even up in the low 50s.
Wow.
Having babies.
Okay. All right. So what happens in a prenatal class?
In a prenatal class, I have an anesthesiologist there. He talks about the epidural, about anesthesia. Then I do have another nurse that comes in my class, and she also talks about the labor part. And she talks all about the labor, as in the stages of labor, when you're supposed to go to the hospital, what are the danger signs that you need to go to the hospital. If, for instance, you rupture your membranes, or you think you're contracting. That's when we tell you when you should be going to the hospital.
Okay.
And then from there, we take it to the stages of labor, how you end up having a C-section, what are the factors why you should have a C-section and the risks for why you need to have a C-section, and then the C-section recovery, and also the vaginal recovery, and also we do the newborn care too.
We try to do that thing so nobody has any surprises.
Yeah.
Is that kind of what that's all about? 'Cause
Right.
Surprises are good if they're happy surprises.
And the
but if-
biggest thing,
Yes.
the biggest thing is a lot of patients have a lot of fear. Once they
Yes.
go to my class, they get
Yeah.
all the information, and then their fear is limited now. So they have a perfect vaginal delivery or a C-section. They're already prepared for it.
The elimination of the fear of the
Yes,
unknown. I
yes,
like that.
exactly.
Dr. Barnes, let's talk, and this is something that somebody gets pregnant, and I'm going to focus on pregnancy, otherwise the show's going to go by so fast.
That's right.
Weight gain in pregnancy. That's like, oh my gosh, you start hearing that early on. What is appropriate? And is that even a real question to ask? Because I know it's different for everybody. I respect that as well, but
Yeah.
in general.
Absolutely. I mean, I think the biggest thing is people have always said, oh, I'm eating for 2 now. And our college, the American College of Obstetrician and Gynecology, they put out tons of opinions on this, and the Institute of Medicine, World Health Organization for this. The biggest thing is, one, always talk to your doctor. It is patient directed. I would say the recommendation on an average person is about 15 to 25 pounds.
Wow.
Yes.
Okay.
However,
What? That's it? That's what everybody at home is saying.
That's
Oh.
it, yeah. That, it does depend. A lot of times it does depend. It's pre-pregnancy weight, and they look at your BMI, so body mass index, and then they base it off of that, and they tell you what is okay for weight gain during pregnancy. And looking at that, we also look at how the baby grows throughout the pregnancy
Right.
as well. If you're not gaining any weight, that's okay as long as the baby looks good.
Okay.
Okay, but I'll always talk to your doctor as well. That's going to be the big thing.
And I remember the last time we had a show similar to this, sometimes it's advisable to lose weight during pregnancy, depending, you said check the BMI first, but I don't know, it's a loaded thing to say, but
Yes, that is a loaded question.
Yeah.
I would say that the correct response is absolutely not. That's
Okay.
not. It's not recommended. Some type of weight gain is always encouraged, especially for the health of the mom and the baby.
nice. So that's a great transition. I'm going to stay with you for just a second or
That's
two,
fine.
Dr. Barnes, is the nutrition, because I'm glad that we established losing weight also sometimes can be associated with not getting the right nutrition that you need during the fact that you're climbing up that mountain. I'm just thinking of what to expect when you're expecting.
Yeah.
Somewhere in there, I was like, that's it, I'm climbing a mountain every single day while I'm pregnant. But talk about the nutrition and either extra or good if it's one in the same.
I mean, I think that as long as you're eating like a healthy, balanced diet, the patient's okay. There's nothing, there's a couple of things that people would say to be cautious of, but really nutrition-wise, as long as it makes you feel good and you're eating a good, balanced diet, and you can talk to your doctors about that as well, is okay.
Nice. Beautifully explained. Dr. Mendez, let me ask you about, so this is not a tough question, but you deal with younger patients. If you, of the people on the panel, you would be the person that deals with younger patients. So younger girls that get pregnant, as far as them being able to tell someone, and I know this is loaded as well, because then there's the idea of like, oh my gosh, mistake is the wrong word, but in general, how and where and who should they go to first? And Sandra's also nodding her head, so feel free to piggyback on this as well. But I wanted to address it because that is a real thing in every society, and I think that nobody wants to talk about it. So
That is actually an excellent question, because we do have to deal with that. Sometimes I'm dealing with kiddos who may not be at home They may have a not so good home situation. So then it's whoever is taking care of them or whoever, a trusted adult that they feel that they can go to. Maybe they have a really good friend. Sometimes it's actually the family of the father of the baby who's taking her in. There have been other situations where they've come in for a birth control consult and they're already pregnant. And at that point, I will offer to sit there with her if she would like to explain that to her parents, or alone, or with me in the room. Whatever, it's really whatever the patient is comfortable with and whatever they want to do. Most of the time, the parents are very well aware, and a lot of the times it's the teenager who doesn't understand that their parent brought them in because their parent loves them and is wanting to take care of them and is actually there. They just don't know how to bring themselves together to say sometimes some harder words to say.
Right. And again, it's nice to know that that's out there. And Sandra, I'm just going to give out your number again, just because, and either way, people can direct this question if someone is pregnant, doesn't quite know how to handle it in the beginning. It's 521-1279. And Sandra, I would love to talk with you because you do prenatal classes.
Right.
You also do breastfeeding classes.
That's correct.
And I think and I'm just going to use me as an example. I thought breastfeeding would be the most natural, easy thing in the whole wide world. That's what everybody does. And oh my goodness, my first child, it was just,
Yes, it is difficult.
you know, she did not want to latch
It is
on. We
difficult
did this
at the
little
beginning.
training thing with tubes and pinkies. And so talk about what you teach in class, and then talk about the real world of what things may not click when the baby's born or what does click. So
Right.
that's loaded as well.
Yes, and I do prenatal classes in the breastfeeding, but I'm also a nurse in postpartum.
Great,
So I do
okay.
a lot of teaching with my patients, and it's starting from all ages, and of course I have the good support of the parents. Usually the mom is there and they understand everything that I'm pretty much telling them, and I tell the patients to listen to their mother because their mothers are wise.
Right. I
And
like
then-
that, yes.
And then also, so when you start with the breastfeeding, you have to have the confidence to start teaching your patient. So once you get the confidence and they start listening to you, then the breastfeeding is going to go much easier. First, you have to tell them basically the position and the latch. And you have to be very, very patient because the first milk that you do get is your colostrum.
Right.
It is your colostrum, but that's all the baby needs for the first 3 days or a couple of days until you get the mature milk. But then again, you have to be patient because I always tell them it's not a button that you just push on and all this milk comes out.
Right.
You have to work at it, okay?
Right.
You do have to work at it, and breastfeeding is a job. It is a job. Therefore, they need a lot of support at the hospital and also as well at the house. They need a lot of support and a really good support system. So that's how come we also have the baby cafe.
Right.
Once they're discharged there from the hospital, they do have the opportunity to go to baby cafe, and that's where we're going to teach them a little bit more if they feel at home and they're overwhelmed. Because usually
The baby
what,
cafe, so
yes.
it's more of a once baby's born, you've gotten baby home, it's been a
Yes.
week and things aren't going
Yes,
really well, I'm going
exactly.
to the baby cafe. I needed the baby
Yes,
cafe
yes, you
22
did.
years
Yes,
ago.
you
I'm
did,
just
yeah.
saying. And on that note, Dr. Barnes, you're so cute because you're sitting here nodding and
Yes.
smiling. And so breast milk, breastfeeding, it's separate, but at least you're getting the breast milk. So pumping, because we talked a little bit about this before the show, talk a little bit about pumping. And if you, for whatever reason, the breastfeeding isn't working, and I don't even want to go there because that's 5 hours worth of the
yes,
show.
it is. Yes,
But
it
let's
is.
talk about breast milk and importance.
I mean, the importance of breast milk, I mean, it has all the vitamins and nutrients that the baby needs. It is low calorie, so that's why we have to feed them often. It turns into a job. I mean, but
Vaccines.
vaccines. Oh, of how we get vaccines into
Yeah,
babies.
so the
as
babies.
well.
Yeah.
Oh, that's right. So all
Yes.
the
The
antibodies and all the stuff that
antibodies,
we've had
yes.
with vaccines, it helps with all of that
With the
as
immune
well.
So it gives them
Right.
their immune system.
Yes.
And so we were talking about
Sorry.
pregnancy weight a little
Yeah.
while ago, and it also helps contract the muscles in the
Yes.
stomach, so your
Correct.
weight starts, it helps out with weight loss and all that good stuff. And that's with pumping as well as breastfeeding, right? So
Correct.
it's either or, and both, I should say. Dr. Mendez, let's talk about the actual birthing process. Let's get into that for a minute. So there is the idea of natural birth, which, what does that mean? Does it mean that it's natural birth but I have an epidural, natural birth but I don't have an epidural? I think that in and of itself is loaded because natural birth in my head is anything that's not a C-section, but I could be thinking of it wrong or differently. So when you hear natural birth, or patients come to you and say, well, I like a natural birth. Do you ask them, what do you expect when that's
Yes.
the wording? So I'm going to just have you take that away.
I think you're explaining it correctly, and you're right on. I think that's a very personal experience for every woman. Every woman might think that, oh, I don't want to go to a hospital, that's not natural enough. I want to deliver at home or in a different setting. I agree with you.
If it's not a C-section,
vaginal
then yeah,
delivery,
okay.
and I think having an epidural or not having an epidural is also a very personal experience for the woman. I tried to get as far as I could. I got to 6 centimeters and apparently was screaming. So
I don't remember, but I think I was screaming. You got it too? It's funny, my and I won't say who he is, but my first doctor with my 22-year-old, he said, if you're not going to do the epidural, I think you need to find another doctor. And I was like, because I was just, you go in with your list, you've got your books, and you're at Barnes & Noble, and I literally went in with my list. He goes, just put that down. Let me just give it to you straight. But and it wasn't in an ugly way. I mean, he was kind of joking, but it helped me ease my idea of, okay, it is a personal experience. You go through it the way you think is right, but then having too much information sometimes is a little crazy. So Sandra, I'm going to ask you about that. When people come to your prenatal class, chances are they've looked some stuff up already. When is it overload of information that they're getting from the outside world compared to what they're getting with you and the real information? Does that happen a lot?
It does happen a lot. Not even in the prenatal class. It's in the patient care too.
So you said you do right after you do post-op too.
Yes,
so
we do. I take care of the vaginal deliveries and C-sections, and it's a couplet. So it's the mom and the baby that we take care of in the postpartum unit. So there we have to teach the mom and the family, because the family is always there to give them support.
Bingo.
So we're teaching the family as well. So here, when it is, oh my gosh, what was the question again? What was the question again?
I forgot.
was going off
well,
on
actually, we're
something
just
else.
going on anyway. We're about overloading, information that's outside.
It is a lot of information,
Yeah.
but when they're there at the hospital, every nurse is going to be teaching every day the same thing. So hopefully they get it in their mind of what they need to do. So overloading, they pretty much understand it, because basically what you have to do is basically just feed your baby, make him pee and poop.
Right.
That's basically the basic needs of the baby.
I would like to, and I know this is in no way a psych show, but there are stressors when the baby comes for both mom and dad. And yes, all we need to do is feed them and change their diapers, but when the stresses happen, when the baby won't stop crying, when, what do you three, and anyone can answer this who would like to, what do you three advise new parents that just are at their wits' end? I don't know how else to ask that. I'm going to ask Dr. Barnes first. Dr. Mendez, I would love for you to piggyback on that as well.
I would say exactly what people told me: ask for help.
Nice.
And
okay.
if somebody's offering you to help with the baby, take it. Don't be brave. Don't. Because it's going to get to you, and then you yourself are just going to get more and more frustrated, and you're going to just go down this slippery slope that you might not come back from, and that's scary sometimes.
Yeah.
So that's a big thing for us as well.
Ask for help and take it.
Yes.
Nice. Dr. Mendez?
I think people don't realize how much you don't sleep. So you're
Right.
up constantly. You're breastfeeding, and I would pump after I breastfed even at night. I only did that once. I'm not doing this again.
Right.
It's really hard, and then when you go back to work, it's even harder. I agree with Dr. Barnes. When a family member or a friend sees you and says, "Hey, I'll take the baby for you for a couple of hours," just take it, even if it's just for a nap. Don't worry so much about your house being spotless. I know having people over can be a stressor too, because our houses may not be the way that we want them, and it's okay. People understand that.
I remember the first time I physically left my baby, and it was like 5 days later. And my ex-husband now just said, I asked, I just want to go to Target. I just want an hour.
Yes.
Just give me, and it was the best hour of my entire life. I'm saying that because having babies, it's bliss. It is. But we also have to realize there are times you just need to take a breather, and it's healthy and good to do that. So let's talk now about not the bliss part, but let's talk about complications in pregnancies. I had a miscarriage. I feel like for many, many years I didn't ever want to tell anybody, because there is a little bit of a, what did I do wrong? And I was just thinking, and I can't remember who it is, but just recently I feel like that's something that people are starting to talk about more. Celebrities are coming to the table saying, yeah, well, I'm having a miscarriage, and it's just something that we should bring up a little bit more, because I thought I was the only one that had a miscarriage until I mentioned it to somebody, and they're like, yeah, I had 2 of them. Oh yeah, well, I had one, and I had one. And then people start that conversation. My question is, what could happen in a pregnancy that would cause a miscarriage? And I want to be careful here, because I don't want this to be this is what the mom did to make it happen. I'm talking about just natural things that may cause a miscarriage, and mom shouldn't feel guilt, although she just naturally will. What are some things that can happen that can cause a baby? Spontaneous abortion, I think that's what they call it in doctor's office, and just the word abortion just makes you feel, what does that mean? So again, it's all these feelings that you get. Dr. Barnes, I'll start with you.
I think one of the biggest things and the most common reason is just things didn't come together just right. I mean, it takes exactly what they say. It takes 2 things. It takes an egg and a sperm, and sometimes they just don't click like they're supposed to, and that's kind of the most common reason why this happened, and it's nobody's fault. It doesn't mean it's going to happen again, but if it does and it keeps happening, that's something that obviously you need to go see your doctor about. And I think those are the biggest things of the kind of easing people's guilt from that standpoint.
And on that note, Dr. Mendez, I'll ask you, for example, I remember when I had my daughter, I had a miscarriage in between my daughter and then I had my son. And I remember when I was having my miscarriage, I was almost 3 months along, and I had a dental appointment a month earlier, and we did x-rays, and in my head, that's what happened. And it's just one of those things you can't. So I'm asking that what are some of the things, once you know you're pregnant, that you want to try to stop doing to lessen any complications? Again, not that there's a blame put on anything, but just because we're on this transition right now, what are some of the good things to do while you're pregnant, and some of the things that you should stay away from while you're pregnant?
I think one of the biggest things is actually even before you get pregnant, start your prenatals because of the folic acid to help prevent some birth defects, to get your nutrition in order. Things like you don't need to be drinking soda, you don't need to be eating the deli meats. Watch your fish intake because of the mercury levels. Limit that to 2 servings a week. Those types of things we could be doing before our pregnancy. Limit your alcohol and stop. If you're trying to get pregnant, you shouldn't be drinking alcohol at all. Stop smoking, no drugs, things of that nature. Making sure that you're exercising and taking care of your body through physicalness as well as your nutrition. And then you can continue that throughout the pregnancy to have the healthiest baby that you can. That being said, like Dr. Barnes pointed out, most of these are caused by chromosomal or things just not coming together correctly.
Right.
And there's not much that we can do. I also have experienced a miscarriage, and I think that by talking to you find other people who have experienced that as well. And you're right, we're not talking about this enough yet.
Right. And I'm glad that we're opening up that conversation right now. I feel like, and when I say the old days, I think of the days that I just wasn't around for, but D&C, is that the right word? So I remember when I was bleeding and having my miscarriage, I went to the doctor and I didn't exactly know. I was spotting for the week prior to, and then things started getting worse, and he said, okay, well, we're going to book you into the hospital, we're going to do a D&C. And again, not knowing anything, I'm just staring at him like, what does that mean? And he says, well, have you had anything to eat yet today? And I'm like, well, I had some raisins this morning, and he's like, okay, well, now we're going to have to do an epidural, we can't put you down. So there's all kinds of things that happen. There's the miscarriage, and how often does a woman have a miscarriage and it's done all on their own, because it takes a while? And how often do they go in and have the doctor really clean everything out and make sure everything's fine? And I'm looking at both of you as surgeons. Dr. Barnes, I'll start with you, because I think that you said that you're doing more surgery at this point. When is a miscarriage to the point where a doctor needs to not intervene but get involved?
Well, I think earlier the better. One, to talk about options, kind of what may be looking forward to and the symptoms that you might have, talking about pain control throughout the process. That could be a big thing.
And talk about the symptoms, because I think spotting is one main one, but are there other ones that people should be looking for?
Absolutely. It's not just a spotting, it's bleeding.
Okay.
It's saturating pads, underwear, passing clots. Those are kind of big things, and definitely intervention where you need to see a physician
Okay.
or go to the nearest hospital. At that
Okay.
time. The cramping as well, your body's actively trying to deliver. So the cramping's the big thing. If you're feeling chest pain, lightheaded, anything like that, those are like when you need to seek medical attention as well.
Okay. So let's talk about, and the only person I know is me that went through it. So a week before my miscarriage, I was spotting, went to the doctor. There was a very faint heartbeat, so I kind of had in my head that he said the pregnancy may not take. So not that that's lucky or not, but I felt like there was a little bit of a warning sign. So with women who might be spotting a little bit, when should they go to the doctor? Should they go to the doctor either way when there's a little bit of blood? Either way, no matter
Yes.
what? Dr. Mendez? Okay, take
Yes.
that one.
I would definitely see a physician because you never know. And very early on, if you have not established this can actually be an ectopic pregnancy. So is the pregnancy somewhere other than in the uterus where it should be? Because that needs more and immediate medical attention. The other thing too is there may be things that we may need to monitor. For instance, with my third pregnancy, I had a chorionic hemorrhage underneath the placenta the whole time. I bled almost
Explain
the entire.
what that means. Okay.
Where there's blood underneath the placenta.
placenta,
It's
okay.
starting to come off the wall before it should.
I see.
And I
Okay.
had that pretty much the entire pregnancy to the point where I actually thought I miscarried.
Wow.
And so I understand my patients a little bit more now when they're like, no, I had a period this day, but they're still further along than they thought. Now I get, how that can happen.
Okay.
So it was something that needed to be monitored the entire time.
On that note, we talk and hear about bed rest all the time. Dr. Barnes, since you giggled, that's the way it works. If somebody winks at me, smiles, or does a little foot thing, that means it's your question. So when is when? When bed rest is something you need to consider. And again, there's a whole slew of different things. I get it. But just in general, most common.
In general, most common is now recommended against it. Because of the side effects that can happen on a mom.
Okay.
You are in bed the whole time, you're deconditioning yourself, so your muscles are getting smaller, you're getting more weak and fatigued, so we saw worse outcomes for these patients. We also,
Makes
when
sense.
people got bed rest, they were like, well, we're gonna prevent some type of bad outcome, or preterm delivery is most of the common things. They found really no difference in people that were walking around and on bed rest. So I would say people do different things. They put you on pelvic rest, meaning no intercourse, nothing in the vagina, taking it easy, light ambulation, and walking around is kind of the big thing just to keep you active. So it's restricted activity and not necessarily bed rest now.
That makes perfect sense to me. I remember too, so my again, going to your yearly exam, it's like, well, how many pregnancies have you had? How many live births have you had? And if you had a miscarriage, you always feel a little bit like, oh, that's right. There is 2 live births, 1 or 3 pregnancies. At the time when I had my third child, and I was just scared to death because I had just had my miscarriage. And there is an older woman, and it made sense to me. She says, well, if you feel like, putting something around your tummy to hold your tummy in versus having bed rest, she was just absolute sure that was a thing. Is that even something we talk about? You were talking about giving your vagina a rest, maybe not pressing the weight on there if you're up and around walking, if you have to work, etc. Is that something that's even, again, you're smiling, Dr. Barnes. Sorry.
It's okay. Absolutely. I mean, we have
It's like
a
the
certain
stomach band holding baby in.
Exactly. It's called a belly band.
Belly band. I couldn't remember the name of it. Thank you very much. That makes sense.
For different reasons, people might enjoy having it, especially if they're working on their feet all day, further along, kind of more towards their middle of their second trimester. The baby's big enough. We do have ligaments. They're called round ligaments, and people will get this pain because it's a spasm. So sometimes to prevent that or help with that, we have use the belly band to lift the belly up and keep it there.
I think it also takes some pressure off their back.
It's true.
Yeah,
Yes, we get a lot of patients complaining about back pain.
And I think my problem was, and the reason this woman was talking to me, I had a ton of Braxton Hicks. I mean, really, from the time I had a little bubble in my stomach, and I just felt like something's happening. And maybe talk about what Braxton Hicks, am I saying that right? Contractions are, what those feel like versus the real contractions. Some women don't have them until the very end. I had them throughout my pregnancy, which is why I was just like, okay, this belly band. I never got one, but I wanted one. You know, when she told me about it. But talk about Braxton Hicks contractions and what physiologically is your body doing when they occur.
So a Braxton Hicks contraction is when your uterus is kind of practicing on its own to actually contract. It's a muscle, so just like any other muscle in your body, it's got to learn to contract appropriately so that eventually when you do go into active labor, it's doing it appropriately. And you may feel that, you know, a few times a day, and that's actually normal.
It's over now, but man, at the time they freaked me out.
They can freak some patients out. If it's bothering you, you can, you know, lay down, drink a little bit of water, make sure you're staying hydrated. If they're getting worse, and we usually say about 5 minutes apart, maybe they're not just Braxton Hicks, you need to be checked out.
Okay. So on that note, I'm going to ask, because sometimes you don't know when you're really going into labor or not. Sandra, it's your turn. We haven't talked to you in a while. So Sandra, how do you really know when you're going into labor? And I'm going back to baby number 1. I thought I was going into labor, but no.
But you could
A couple
time
of days
it.
later, you know.
It's like 1 to 2 minute contractions. That's when you should go to the hospital.
And
but they're
maybe
timing
explain
them at home.
like the different types of contractions, because there's, and I'm going to be very blunt.
Right.
There's a contraction that you feel like I just have to have a bowel movement or 50.
Oh, you see, when you have a bowel movement, that's
that-
when you need to go to the hospital.
Okay.
You feel a lot of pressure.
baby's head.
Yeah, you feel a lot of pressure
But
there.
there's
Yes.
nothing, you know, so maybe if you
there's
could
something
describe
there.
the different feelings. Yeah, there's something. Yeah, exactly. If there's something there.
But there's like a mother intuition saying, I need to go to the hospital now. Because your contraction has to be regular. It has to last longer, or they last longer, and then they get the contraction much quicker. So if you have a regular pattern like that, and you walk around and you're still getting those contractions, then you do need to go to the hospital.
Okay.
But the most serious one, when you need to go to the hospital, is when you rupture your membranes.
Yes.
and you just know water breaking.
Water breaking, I gotta
Okay.
go to the hospital because you're protecting your baby as well as the mom.
I got to tell
when
you, I
you
love this
rupture.
show on PBS called Midwife. Did you guys know this show? I know you do. No? No. Anyway, it's all about baby delivering. It's crazy and it's fun. But membranes, both children, membranes did not break. And I guess that's part of my thing too, because when baby number 2 came around, I thought, oh, I'm not in labor. And I'm literally putting in a wooden floor in my house, the nesting, I'm up on the cabinets, I'm painting. Don't do that. Don't do that. He came 2 weeks early, but I totally did not think I was in labor. So I just went to my regular appointment thinking, yeah, I'm just having these. Okay. He checked me and says, you're in labor, go to the hospital. And I guess that's my question, because sometimes you think you know, but you don't really know. And I guess that's you said earlier, it's very individualized.
It is.
And I guess and you've had 3. You've had, right? You had 3
pregnancies.
3 pregnancies.
I have 2 babies.
Okay, 2 babies, 3 pregnancies. How many babies?
1.
Okay, so did you well, you guys are doctors though, you know.
Oh no, I was admitted. I was back then. You got admitted at 4 centimeters, and I labored all night. Nothing happened, so I went home. So my husband was not very happy with me. But when the real contraction started about a week later.
A week later, so that was a whole week earlier. Okay.
I could tell the difference.
Okay.
So even being an OBGYN, I didn't know.
Okay.
You don't know until it happens to you.
You have a story, and you were nodding too, so you have a story too. What was yours like?
I was induced.
You were induced. Okay.
So, but every day I would tell my husband, I would be like, I think I'm leaking. I think I'm leaking. I was like, am I leaking? And I would just go through this, and he's like, how do you not know these things? And
Well, that's a great question, because
and I would do
again, we're being
exactly-
blunt, because sometimes when you said membrane
Right.
breaking, sometimes it's really obvious.
It's really obvious.
Sometimes not so much. Maybe
Yeah.
there is a little bit
trickle,
of leaking.
Yeah.
just a little trickle
Yeah.
or leaking, so you don't know.
And I tell exactly what I was taught, and what I tell my patients is, when you don't know, take off your underwear, walk around. If you have like little drops or dribble, then most likely it's your water, and at that point you can go get assessed. Obviously, if there's other issues, I just didn't know.
Yeah.
But when it happened,
I love that you guys didn't know. I
But when
gotta
it
tell you.
happened, yeah,
Yeah.
it happened. And
All right.
it was not what I thought it was. before.
Sandra, did you have any babies in your life?
I do. I have
okay.
a 25-year-old.
Oh, okay.
25-year-old. And
Do you
I
remember
just,
25 years
no,
ago?
I do not remember. I do remember just, I was walking, because that's usually what they tell you,
Right.
walk around. But I never drank manzanilla tea, which is chamomile tea.
Oh, that's hilarious.
That's
I
something that
forgot
they want to
about
give you all the time so you can start your contractions.
Right.
Is
Or
that correct
castor
or right?
oil.
Sure. Oh, don't do that.
Oh, gosh.
No, don't do that. That's
No.
not right. So I walked and then I said, okay, I think I'm in labor. But I was in labor for like 10 hours or 12 hours. So I didn't like just laying there. So maybe the second baby, but of course I'm not going to have any other children, that would have been coming much easier because your uterus, I think, knows already that you're pregnant and it starts having contractions, your second or third baby. Your first baby's a little harder because, of
Okay.
course, it's the
Takes
first
longer.
baby.
Right. Exactly.
So I didn't feel any contractions until I got to the hospital, but then I was like, I wasn't even dilated, maybe just 3 centimeters.
Oh, you're that mom.
Yeah,
Whatever.
I was that mom.
Okay.
So I was there. I enjoyed the hospital.
You know what else freaked me out
Yes,
while we're
tell
on
me,
the
Dr.
subject of
Mendez,
not
yeah.
knowing was the mucus plug. Because
Okay, I never experienced that either.
Never
So I was
Mine
waiting
took
for that to
days,
happen. It never happened.
days.
So it started and it was taking days for the plug to
just
completely
came
come out.
out. Yeah.
Okay.
So I think some people have it, some people don't remember, and some people it just like they're like, I'm still having some stuff come out, and I'm like, yeah, that happens.
So I know this is big time web days, but what to expect when you're expecting, and I don't mean to make a commercial about a book, but I really read everything in there, and whomever your partner is, there's at least one chapter that they don't have to read the book, but there's at least one chapter, and I'm just saying this to the guys, just read that one chapter, because it says if your husband doesn't read any of this or your partner doesn't read it, have them read this one chapter. But it's nice that your partner kind of knows what's going on as well. If you have a partner in your life, if not, mom, if she kind of forgot, et cetera, et cetera. I can't even just the mucus plug. I forgot all about it until you brought it up. But I remember when I was pregnant. Again, I didn't know I was in labor because that never happened either. No membranes broke, no mucus plug came out, and it's all gross stuff that if you're not in it. But this is what we're talking about tonight. What is the purpose of the mucus plug, Dr. Mendez? I'm dead serious because it's just you read about it, and if you have never experienced, you just kind of scratching your head, going, "What is it? Why do I have it? And why is it going to go away?"
It's a
So-
plug. So
It
it's
just
there to
holds everything
protect,
in?
It's to protect the baby, to
Okay.
prevent infection.
And that is on top of water breaking. So mucus plug and water breaking are two different actions, correct?
Correct.
Okay, so talk about the difference between those two actions.
So the mucus coming out is usually a little bit thicker. It looks like mucus. Sometimes it can be a little bit of bloody show, but you may not have actually ruptured your membranes.
Okay,
So we do tests for that when you come into the hospital and just to make sure.
okay. Do they usually happen within the same day, same week? Is it different with everybody?
It can be different with everybody.
Don't they
what's so hard
usually
about it.
say that it's maybe 2 weeks before you lose your mucus plug and then your labor is going to start?
Okay.
That's what they usually say.
Wouldn't it be nice if that actually happened
Yeah,
the way
like
it was
a
supposed
warning.
to happen?
Like a warning somehow.
I love that. Again, we're streaming live on Facebook. If you have any questions, we have some questions here from the audience. It's about endometriosis. I know that we talked a lot about the birthing process. We're at about a 15-minute mark right here, so I want to talk a little bit about GYN before we get off the air. But endometriosis is a question from the audience. Number one, let's just ask Dr. Barnes, since you do more GYN, you do more OB, if I understand that right. What is endometriosis? Sorry, it's a mouthful.
Yes.
Is there a cause? What is happening in your body physiologically, and how does that lead to having issues with pregnancy or not in the future?
Right. So the cause right now is unknown.
Okay.
There are tons of hypotheses of why this happens. I would say the most common of what's thought of is that not all the menstruation goes out through the vagina, but since our system is open with fallopian tubes, there's some backflow. And some of that kind of glandular portion that we have may sit there and invade our pelvis or
Okay.
other parts.
Okay.
There's also thought that this could be an immune process. It can go, there's tons of things of why they think this is happening. In terms of why can it affect pregnancy? Absolutely. One of the most common things about it is it can potentially cause infertility.
Okay.
They think because of these spots elsewhere are kind of.
And when you say spots, are they like fibroids? Are they mini?
So it behaves different ways. There's
Okay.
different stages for it. There
Okay.
can be as early as microscopic. So technically, people used to say that you needed to visually do a surgery and see them with your eyes. Newer experts are saying that's not necessarily the case. There can be within the pelvis where it usually is, starting inflammatory responses that aren't supposed to be there.
Okay.
Then you can go to little speckles that look like, they say, gunpowder spots, or they're very red or white. They have different appearances.
And what is the screening test, or what is the test that you're doing to diagnose endometriosis?
So unfortunately, there isn't a screening. You kind of
Okay.
just go through patients' symptoms, and they can be very different. They can be from pain to irregular menses. They can be pain just during their periods versus all the time. They usually teach us the 3 Ds, which is technically pain with your urination, pain with sex, and pain with having a bowel movement, are kind of these signature things. But not everybody behaves the same that way. So you can always, when somebody tells you these things, you can always say, suspect this.
Okay.
The diagnosis, unfortunately, has to come from a surgery as of right now.
Wow. Okay.
There's no test, I would say, that literally that can say that. However, some people do present with ovarian cyst
Okay.
that kind of have a telltale image that this could be a sign of endometriosis.
Gotcha. Okay. How common is it? Like, of the population, I feel like I hear about it all the time.
I feel like unfortunately,
Well,
unfortunately,
this is what you guys do, so
Yeah.
you are going to hear about it all the time.
right.
But-
I trained with where Dr. Mendes did, and a big hub. It's a chronic pelvic pain center for worldwide. International people come there, and I felt like I had a bias, and I heard about it all the time, and it was something that we were very attuned to. So I would say we had majority of patients with it. Here, I don't know. I think it's
I would say 5 to 10%.
Yeah.
5 to 10%.
Yeah.
Okay.
And I think a lot of patients don't always present that either. They present for primary infertility.
Okay.
that's another thing.
And see, that's a whole nother show.
Whole other show.
So we're at about the 12-minute mark. So Dr. Mendez, I want to start with you. You said you do a lot of education with what you do too. So is there something, and yes, there's a lot that we haven't talked about, but is there something that you wanted to get across this evening that we have not been able to talk about yet this evening, or maybe something that you want to reiterate that we have already talked about? This is like that
think
commercial. It's
we're
like on your
covering a
drive over
lot.
here. There's a ton.
We're covering a lot.
Yeah.
So I mean, I would encourage people, if there's anything that has come to your mind, just write it down, call your physician, ask those hard questions sometimes.
Agreed. That's it. Okay, Sandra, your turn. And then when you think of some more, we're coming back to you.
Exactly.
That's why I
Are
always
you
start.
sure?
No, it
Are you
takes a while.
sure?
It takes
and then
a while.
the patient calls you back. And
Yeah,
it's
and it's
okay.
like, okay, Sandra, before you even start, I'm going to give out Sandra's number, not your personal number,
No.
but you can say, hey, I listened to Sandra on the air. Her number is 521-1279. That's actually the number to the Las Palmas Medical Center.
Medical Center, yes, for the prenatal classes and the breastfeeding classes.
There you go. And again, those are held the first and the last,
last
Saturdays.
yes.
Okay, great. So now, what would you like to say to the
What
audience
would
that
I
we
like
haven't
to say?
touched
Just
base on yet?
prepare. I want to go ahead and basically say, patients, prepare for childbirth, because it is a marathon. And once you
It
take your
is a
baby home,
marathon.
it's another, your life is going to change totally. So you need to rest. You need to rest your mind. You need to feed your body, so you could go ahead and feed into those physical demands that the body needs for childbirth. And prepare your mind for breastfeeding. So once you start preparing, then you get that fear out of the way, then it's going to be an easier ride.
I have a question for you that you may or may not cover in your classes. I remember, at least with baby number one, my mother died 25 years ago. So I had no one around me. I had no family. All my family's in Germany. It literally was me and my husband and the bomb in the back seat that we were driving home with. And it was one of those things that you're like, what do you do when you don't have any help, and now the hospital says, go away,
habits.
And you kind of are just overwhelmed with what to do. What do you tell your patients in the prenatal class? You're going to have your baby, and then there's going to be a point where the hospital says, you go do your thing now. What do you tell them?
Basically, just call the hospital. Basically, just call if they have any questions or concerns, and they have no
What's
family.
the first thing they should do when they go home?
Once they go home is they don't have no family. I was going to say no
Right.
family. Well,
Yeah.
you do need family up to a point to come over to help you with the chores.
Say you
the
don't have 'em,
cooking,
'cause literally
the
that was
cleaning.
my
So you don't
situation.
have
There was
anything
no
like
one.
that. So basically what you do is you need to go, maybe in the prenatal class you could find a friend.
Okay.
And they could give you the support there that you need, because you cannot do it by yourself. You need a really good support system for taking care of your baby and breastfeeding.
Okay.
You really do, because it is a challenge. It is a
Dr.
challenge.
Mendez, you're looking at me and you're smiling. That means you have something to add to this.
Well, we don't have family here either.
Yeah.
And it is hard. You do make friends.
Yes, you have to.
The baby cafe, I had to go to the baby cafe.
I love the baby cafe.
Yeah,
That's the idea of the baby
you
cafe.
meet all kinds of great people, and they can always maybe point you in the right, direction on who can help, or set up some kind of buddy system for you. I think it's a great idea to just reach out to other people.
And Dr. Barnes said, ask for help. And
Absolutely.
that's a big thing, so definitely ask for help.
I did think of something.
Yes, please. Dr. Mendez, you're so cute. Okay, go.
So I think we kind of touched a little bit upon postpartum depression, but we didn't actually say the words.
Right.
And I think that it's important that even if you feel that you're not quite feeling right, or you don't understand what you're going through, or why you are having some thoughts or feelings that may not be what you thought you were supposed to experience. Or maybe you look at somebody else and you say, well, why does she look so happy and I am miserable?
Yes.
You need to talk to somebody. Please do not be afraid to come and talk to somebody, be it a friend, be it your physician, be it somebody at the baby cafe. Please say something. You should be getting screened at your physician's office. I think they're moving towards screening right away now postpartum.
We do it.
But also at your 2-week visit, and then again at your 6-week visit. But if you cannot wait that long, or even if you're just having those thoughts, just call. Just call.
Now, when you say screening, that's after baby's been born.
Right.
Correct?
Even
Yes.
before.
Even before. If you kind of
Let us
and also
know.
if you kind of know if you're a person that has anxiety. My daughter, for example, it's like I know I'm screening her if she's pregnant. Period. Because
Absolutely.
there's going to be
Absolutely.
issues all the time. So I'm very, very glad that you brought that up. And again, a phone number to call if you're experiencing something. I just think of this phone number as even if it's not a class, they can at least direct you to the right
and
place.
then when they do get their postpartum discharge paperwork, it has all the information where they could go ahead and get a hold of a nurse. They they have the number there to call the unit in case they feel overwhelmed, and they feel like if they're not doing a good job, because that's when the postpartum depression kicks in. And they're not alone. I always tell them, you have the baby cafe. You could be talking to somebody who's having a hard time, but you're already having you already got the breastfeeding down correctly. So now you could go ahead and assist another mom that's starting.
So since we've talked about Baby Cafe, when is Baby Cafe? Is that
Baby
every day at a certain time?
No, Baby
place?
Cafe is at 3333 North Mesa. It's at the Life Care Center, and it's
Okay.
on Thursdays from 9 to 11.
So every Thursday from 9 to 11.
Right. And we have a
Okay.
lactation consultant there, and then I'm a lactation counselor too. They could call me at work also.
Okay.
They call me usually. We also have a phone, a breastfeeding phone with us, and we answer the phone 24 hours a day.
24 hours
24
a day.
hours a day.
Where were
That's
you
what Las
22
Palmas.
years
That's what
ago?
Las Palmas is doing now.
Dr. Barnes, it's your turn. Is there something that we have not talked yet about that you'd like to talk about or expand on?
I mean, I think the biggest thing is the being prepared. Not only like at home, but like Dr. Mendez said, there is something called like preconception. Go pre-pregnancy, going to the doctors before, talking about medical problems, talking about your medications, ironing out any type of habits that you have, alcoholic beverages, smoking, narcotics, or any type of medications, vitamins, even if you're not sure of, that can potentially be harmful for you. I mean, the whole point of that is to get the mom healthy so that you can have a healthy baby and a good pregnancy.
Right.
And if we find things out early, we can help you early and get you to where you need to be to help kind of suppress this anxiety and help the pregnancy go a little bit smoother. I think
Yeah.
that's the biggest thing.
And I love how all three of you are. Just find someone. And again, if you don't have family here, just find someone you can latch onto. I was very, very lucky when I was pregnant. There was a girl that I made friends with when we were pregnant. She was 3 months ahead of me. She was also a trained nurse. So literally it's like, hey, Jenny. And I will say this, we were at home, my baby had a little bit of jaundice and she hadn't pooped yet. And I was and then it was black tar that came out of her. And I'm thinking, what? And again, I feel like I should have known that, but I didn't know. So I'm calling and she goes, that's perfectly normal. It's So it's nice just to have someone, if you know someone who's recently had a baby, that's nice too. It's not going to be the same thing ever. Nobody really knows exactly how you feel, but it's something similar. Question here from the audience, and it kind of goes to what we were talking about earlier of dates of the first period and then dates of the last period. We have just a few more minutes, so I want to talk super fast about dates of the last period, of the change of life, of when menstruation starts happening. And it's around the 40s. I've got 2 minutes. I just want to touch base on it because I would love you guys to come back. Okay. We talked about babies tonight, but there is so many other issues that we could talk about. And an hour does go by super fast. But menopause, when does that start? Peri, menopause, post,
So we
Dr. Mendez?
We get women starting to complain of symptoms as early as in their 40s. So that is something that I get asked quite often. I'm only 43. Can this actually be happening to me? I felt like I woke up in a sweat last night. So yes, you can actually start experiencing some of those symptoms earlier on than maybe you might expect. Talk to your family. Look at how your other female family have gone through it, at what age. That can kind of give you an idea of when can you expect things. Every average age here is about 51 that you'll go through menopause, and the definition of menopause is to not have a period for a year. For no other reason. Yes, for no other reason. So you may start to get periods, every 3 months, 4 months, and that would be pretty normal for somebody in their 40s.
Okay. And that, again, is a whole nother show, too.
Yes, it is.
Well, menopause could be. I mean, they make a Broadway show out of it, right? But just all the things then that just the things inside of women that start wearing down after menopause. That, I would really love to have a show on that. Maybe it's because I'm 52, maybe not, but maybe so. I'm kind of curious personally. And again, you look up way too many things. I want to say thanks again to our medical students from the Texas Tech Paul L. Foster School of Medicine, Lachlan Bowe. Thank you so much. And also John Piskey, good luck on your tests this week. I also want to say thanks to Las Palmas Del Sol Healthcare. That telephone number again for prenatal and breastfeeding classes, 521-1279. And as always, the El Paso County Medical Society, who has been doing this show again for 22 years. So we appreciate you being here. We'll see you next month. I'm Catherine Berg, and you're watching the El Paso Physician.